What is the target mean arterial pressure, MAP, for people with hypertension? Have you ever wondered what the target mean arterial pressure is for individuals dealing with hypertension? Understanding this can be key to managing your health effectively. Let's break it down in simple terms. Mean arterial pressure, often abbreviated as MAP, is the average pressure in your arteries during one heartbeat cycle. It is important because it shows how well your organs are receiving blood. To calculate MAP, you can use the formula. MAP is approximately equal to diastolic blood pressure plus 1/3 of the difference between systolic blood pressure and diastolic blood pressure. For those with hypertension, the main goal is to lower blood pressure to reduce the risk of heart issues and organ damage. Most guidelines suggest keeping blood pressure below 140/90 millimeters of mercury as a starting point. For some individuals at higher risk, aiming for below 130/80 millimeters of mercury may be more suitable, but this requires careful monitoring to avoid side effects from treatment. When we translate these blood pressure targets into MAP terms, we find that a MAP around 90 to 100 millimeters of mercury is in line with these goals. However, in critical care situations, like for patients in septic shock, a MAP target between 65 and 75 millimeters of mercury may be recommended to ensure organs are getting enough blood flow. It's also important to note that people with chronic hypertension may need higher MAP targets than the general population. This is due to changes in their blood vessels that affect how blood flows. Therefore, managing MAP should be tailored to each individual, taking into account their age, other health conditions, and how they respond to treatment. In summary, while MAP is not usually the main focus in hypertension treatment, keeping it aligned with recommended blood pressure goals is essential for effective management. So, if you are monitoring your blood pressure, remember that a MAP around 90 to 100 millimeters of mercury is a good target for most people with hypertension. Always consult with your healthcare provider to find the best approach for your specific situation.